So good afternoon, everybody, and welcome to 30-Minute Thursdays. My name's Sam Taylor. I'm a sports medicine orthopedic surgeon here at Hospital for Special Surgery. I'm also a team physician for the New York Giants. And on a personal note, I'm a Greenwich High School graduate, so I have a very special place in my heart for FCIAC athletics. I have the pleasure today of serving as the moderator for a topic that's on so many of our minds these days, which is sport participation amidst the COVID-19 pandemic. Today, we have the distinct pleasure of welcoming Dr. Deborah Roach and Dr. Karen Sutton to the discussion. Dr. Roach is a sports medicine psychologist with a large practice focused on helping people with all of the emotional anxieties that come with returning to sport after injury. But today, she's also uniquely qualified to help the rest of us figure out what the heck to do when it comes to returning to play in the face of this pandemic. Dr. Sutton is a sports medicine orthopedic surgeon here at HSS in Stamford, and she's also a team physician for U.S. lacrosse and the U.S. ski and snowboard teams. She's also in charge of the COVID task force for USA Lacrosse and World Lacrosse. So together, and with your help, hopefully, if you have questions, and you can send them in and we can pose those to the panel. We have the next 27 and a half minutes, I think, to shed some light on the unknown. So before we get started here, I just wanted to give Dr. Sutton and Dr. Roach a brief opportunity to give us some information and help lay a roadmap here for discussion. So Dr. Sutton, or whoever's going first. Dr. Sutton.
Thank you, Dr. Taylor. Great to chat with you. You can do a radio broadcast later. So as Dr. Taylor said, I'm Karen Sutton, and we're going to be talking about a few things related to returning to play and COVID-19. So just touching on a couple big things before we talk to Dr. Roach, as well as open it up for discussion. And again, feel free to send any questions in because that's where the bulk of this comes through. We would love to answer your questions. But one of the concerns that we have for these athletes coming in is deconditioning. So almost as we see our athletes experiencing an injury, one of the longest to recover is certainly ACL ruptures that we have to rehab these athletes through. After the COVID-19 pandemic, or what I would call the peri-COVID period, where we're talking about pre-vaccines, pre-treatment, our athletes will become deconditioned. It takes about 2 to 4 weeks for the aerobic condition to decrease. So your aerobic performance after 2 to 4 weeks of quarantine and isolation starts to decrease. One way to really combat that would be resistance-based circuit training. That's a really high yield way that you're going to kind of move your body and get it stronger while covering the aerobic bases as well, get your heart rate going. Another aspect would be the fast twitch muscles. So it's about 4 weeks where you start to switch over fast twitch muscles to slow twitch muscles. And that can be a challenge, especially with our explosive athletes, sprinters, football players, all of our lacrosse athletes, soccer athletes, skiing. Most athletes do require some sort of fast twitch muscles to respond quickly in their sport. In order to combat that loss of fast twitch muscles, it's important during this time to incorporate plyometric training. About 8 weeks of isolation, quarantine, or deconditioning, you start to lose flexibility. And that's one thing that athletes usually tend to ignore. Most of the time, your performance coaches, your trainers, your coaches in general, captains are walking you through some dynamic warm-ups, stretching afterwards. Most of us don't always love that aspect. I tended to rush through that in my athletic career. Dr. Taylor, I don't know if you were a big flexible person, but
not very flexible, and I lost all my fast twitch muscles about 2 decades ago. So
okay, so we'll work. His return to play might be a little bit longer, but as flexibility decreases, it's important to incorporate Tai Chi and yoga. Those are 2 ways to do it, and a lot of times those videos can be found on some of your national governing body. I know U.S. Lacrosse and U.S. Ski and Snowboard are both putting out some ways to condition yourself. And then, as we all know, the unwanted body fat gains can happen during this time because we may be eating differently. I certainly know Dr. Taylor is not experiencing that during this time. But as we're working with our athletes and looking at that unwanted body fat gains, one option would be to switch that ratio and increase the protein ratio during that time to really get leucine in your diet. Another thing we're talking about, so as I work with US Lacrosse, we're working on a return to play, again, during this peri-COVID period, which is as we're still battling with COVID and haven't really moved forward with some of the phases of return to play. The CSCC as well as NSCA joint consensus guidelines overall for return to training following activity, they would advocate around this time to do the 50-30-20-10 rule. So if you look at the table 2 over here on the side, you're looking at really the new athletes or new head strength coach or return from an injury or long activity, those 2 boxes there, and then you're going to follow horizontally to follow that 50-30-20-10 ratio. What that is as you initially return to play over a 4-week period, initially you're going to cut about 50% reduction in testing volume that you're going to be completing on the first day. And then weekly, you're going to go to 30% of your typical training level that you would do, followed by that 3rd week 20%, 4th week 10%, with a goal getting to that end of the 3rd week into the 4th week to return to play. But this is really important. I think a lot of our athletes, coaches, the teams, we just don't want to expect ourselves to come back ready to play, doing your timed shuttle runs, timed mile run. It's just not going to be the way it was before because you're not competing at that same adrenaline level. You aren't scrimmaging each other. You're not playing in games. Practices are great, the things you're doing in your backyard, but I just think we need to be prepared to recondition ourselves as we enter back into sport. And then finally, I just want to give everybody this reference, which is the Aspen Return to Play program. And what they did is worked with a lot of the national governing bodies and our USA various sports teams to come up with some very basic guidelines in return to play. But for those of you who may be athletic directors or working with a lot of teams, it at least gives some general guidelines over a lot of different sports. So I put the lacrosse one up there, and they divide it up into lowest risk, medium risk, and highest risk. And lowest risk would be basically engaging with your household members using your own equipment in the backyard, wall ball, passing, footwork drills, shooting drills. Medium risk going into, then you're at a different venue. So you're in a public venue now, but potentially using your own equipment. And then still doing some shooting drills, free play, not much contact. Certainly you're not playing games and you're not playing aggressive defense on each other. And then the highest risk would be back to participating in any group team or multi-team structured or pickup play. So this is a great resource and it does encompass a lot of sports. So I just wanted to bring those few things to your attention, and then I'll turn it over to Dr. Roach.
Thank you. Okay, so I'm just going to touch on a couple things. 2 big areas that we'll talk about, but then I do want to make sure we open it up to you guys so that you can ask a lot of questions, and then I know Sam's going to have some questions for us. So the first one we're going to look at is sort of the emotional response. I think a couple things to be mindful of is you're working with young people, so their range of emotions often show a little differently than ours. So definitely you're going to see some anxiety. Depression a lot of times in adolescence is more irritability, anger, rage, that kind of stuff. I think a big piece, and I'm sure you've seen this in a lot of the materials that are out there, is the loss. So for so many of our athletes, their identity is really being an athlete. And so if that's threatened, I think a lot of our kids who lost their spring season, maybe seniors who have lost their graduation, if you think of the loss for them, it's pretty substantial. The loss of time with their peers are their primary focus at this time of their life. So not having that engagement is a pretty significant issue. However, with all that, yes, I'm definitely hearing a lot of anxiety, a lot of irritability, frustration, but there is this enthusiasm to come back. So they are ready to get out there and excited to do it. So I think it's encouraging for us to start thinking about how can we do this and mitigate that risk and get them some of this activity, which we know is so helpful for so many reasons. So that kind of just a real brief intro to some of the feelings and emotions that we're going to see. And then the next piece I wanted to kind of just hit on with you guys is for those team sports who are in a unique position here because it's going to be hardest to get that all together at the same time. To be able to pull a football team together is going to be more challenging than our track athletes. So one of the biggest things I kind of put out to the coaches, captains, is to keep the team connected as best you can. So having scheduled time that you are trying to reach out to them, even splitting those responsibilities up among the team. Another chance here is for coaches to kind of see, you've got this group of athletes and what kind of roles can they play? You may be surprised that that quiet kid who is like the quiet junior on your team in this position has this amazing musical talent and can put together these videos for your team that'll be really inspiring and things like that. So I think creatively of how to get everybody engaged and maybe figure out some different roles that may work out for them. Again, within the mindset of overtraining and within the mindset, there are ways you can still have some competition that you can use, kind of working them, having some goals for them, and then having them post it and that kind of thing so that they're keeping engaged. Another thing too, I was thinking a lot about loss of sort of those big games, those senior games and things like that, is that kind of moving that energy of the team into some collaborative thing that they can do for the community. So if they lost homecoming, then how can we do something and give back to our community at this time, led by our football team, something like that. So thinking outside the box of how you can still build this collaboration and cohesion, that's a little bit of a different way. I think it's also an opportunity for you to have members of your team and subgroups connect that maybe sometimes didn't, because you can assign them sort of a buddy where it's like, you're going to check in with this person or you're going to check in on their training so that they are communicating with people that maybe they wouldn't have otherwise. So it's just some general beginning ideas. Like, we're going to get into much more conversation as we go on, but just some ideas to start us off.
Well, that's really good. So, one of the first things that comes to my mind, and we talk about all of the anxieties and the stress of unknown. I mean, there are obviously some good coping mechanisms and some poor coping mechanisms. I've heard COVID-19 referred to as the COVID-19 because people are going to eat more and exercise less. What are some healthy coping mechanisms, Dr. Roach, that you think that student athletes and parents can encourage their kids to do during this time?
I think if they can get out, that's one of the biggest things is to still maintain some of that exercise, because we know that has such a positive effect on mood. I think what I've been working with a lot of people is try to identify some of the things that maybe were their vulnerabilities, and we're going to work on those. So like if they weren't really flexible, we're going to try to implement some of that yoga stuff because we can do that at home. And it's a great strategy. All the mindfulness, all the meditation. Dr. Sutton had talked before that she wasn't great with the flexibility stuff. The mindfulness and meditation was never my strong suit, but I will say it has tremendous impact. And so implementing some of those skills, Headspace, there's great apps out there that they can use. And then I think reaching out, having some of that connection, still trying to find ways to connect with their friends and family so that they aren't isolated. So
along those lines, one of the old adages, or I guess older adages previously, was death by PowerPoint. And, I guess we're guilty here with running a Zoom conference, but today it often feels like death by Zoom or Skype. And, clearly the technologies of today empower all of us to do things that we otherwise wouldn't be able to do during this. But, further along those lines, how would you suggest that people can use those modalities to keep the team energy and the team spirit going?
I think being creative with it, but also being a little silly. Like, I think we're going to have to get outside our comfort zone. And I know I've done some videotaping for organizations where I've blasted out things. And, one of my brother actually had his graduating class. He had done a little video that was just humorous. I think using it in an outside way, even if the coaches get involved in the yoga class, I think it can be good for them to see like, hey, there's coach doing it with us. And having that, kind of taking that more rigid side of ourselves and putting it aside and kind of being a little bit more vulnerable in those ways, I think can help make this human. Because the reality is it's still weird. It's like, I'm with you, but I'm not really with you. And so I think that part of the Zoom and the FaceTime and all that, it's a great modality, but it is still not the same. And so trying to take down some of those barriers by being a little bit goofy, I think can help. The humor thing is huge during this time.
So then, Dr. Sutton, question kind of for you. As we, God willing, transition from this Zoom universe that we're living in, and independent training, and start to work towards some of those, the medium risk and on the risk stratification scale that you showed us. What do you think? What are some do's and don'ts? I mean, one of the good questions that was just asked was, why can't we just go back to practice and wear a mask? I mean, how do you feel about that, Dr. Sutton?
Well, Dr. Taylor,
Yeah.
first of all, when
You can't even tell if I'm smiling or not.
I
Nothing.
can't.
This is kind of good. I'm going to start wearing this when playing poker.
Or if you didn't brush your teeth.
Yeah.
So a couple of things we think about when this is a bit of a twofold question. So you're talking about the medium risk activity. A couple states, so first of all, we do have to follow our public health guidelines. We have to follow what the governors are doing of our states, because it is starting to get a little bit different in different parts of the country who were not as affected as our area was, certainly on the kind of red zone for affected by COVID-19 in our area. So one thing would be follow those guidelines. But then as we start to get into this either phase 2 or medium risk activity, a lot of themes come up in terms of get on the field, get off the field. So efficiency of training. Let's say you are able to go to that small group setting, which will probably be about 10 people to start. So if you have a team that has 50 people, let's say, first of all, it's better to have 10 people practice at 5 different times during the day rather than have those 10 people try to space out on a football field. It does increase the risk if you're, spreading those groups of 10 around the field. The second would be no food on those fields. So really trying to keep any food. Each athlete can bring their own water bottle. Obviously, we don't want to be sharing that. So those are some ways to keep everything safe. And then from the avoiding overuse injuries or return to play injuries, I think it's going to be important not to expect a lot of these athletes, expect a lot out of them at that time. So again, abiding by that 50, 30, 20, 10 rule, where if they get to the field, you're not timing them in shuttle runs, certainly they can't scrimmage or play a game. That's going to increase the risk for potential transmission. Your final question in terms of the mask. So we have actually learned from both MERS and SARS-1 in the past that they've done some studies looking at attempting to have our young athletes, kind of the youth sport athletes, wear masks. And first of all, when they were outdoors, which actually decreases the risk of transmission being outside compared to inside. And then the volume that they were able to express from their lungs, actually, as they were playing, it wasn't very risky for at least our youth athletes as they were breathing to pass back and forth the virus. The second thing would be, as we're talking about our high school, college, our older, even professional athletes or NGB athletes, wearing masks is going to be very challenging. So it increases the inspiratory resistance. It's very hard to breathe with the mask. So you wonder, does that pose challenges in and itself, and actually could be detrimental for the athlete to wear the masks? So just throwing on a bunch of masks, that actually may not control everything and maybe a detriment to your athletes too.
So Karen, one of the things that we've been working through at the NFL level is how basically how the world's going to change, how, and that isn't necessarily even just on a structural level, but it's on a rules level, like we've seen in Major League Baseball's considering, and now that I think the Korean baseball leagues have outlawed spitting and high-fiving, in their sport. And with the at the NFL level, we're talking about reconstructing locker rooms to allow for social distancing. So this is going to be a chain question, which is for Karen, what do you think are some things that can be done on a high school level to mitigate the structural risk and improve social distancing? And then for Deb, the question is, how can student athletes reconcile the effect of teamwork, and I played team sports my whole life, and they became a fabric of who I am, and
Agreed.
and this is something that is a dramatic shift in so many ways, not just how we're going to be safe, but how we interact as human beings and the face of sports altogether. So, sorry, Dr.
Oh, darn,
Sutton.
I got it. All
Dr.
up here.
Sutton, what can we do at the high school level? See, I get on a soapbox. Nobody should give me a camera and a microphone, but
It's okay.
Dr. Sutton,
You're on my team any day, Dr.
right, good. So we still got team sport.
We do.
Um,
Just in the operating room.
Exactly.
So a couple of things I think that the high school athletic directors, sports programs can work on. One is efficiency. The athletes may want to warm up separately, so they may want to do that on their own in a social distancing fashion. They may want to cool down separately. You definitely don't want to have any type of steam showers, anything afterwards, because that actually increases the vapor and the spread of COVID. So when you're on the field, try to focus on the things that you need to do as a team. Decrease the huddle time, just decrease the time that you're talking. They've talked about using, bullhorns if you need to, so you don't have to come back in and go back out. So one is efficiency of practice. Two would be the travel. So making sure when you're playing your teams, I think a lot of this, if we're talking again about, phase 2 or this moderate risk activity, if you can keep everything within your community. So I think traveling to play the number 1 team in North Carolina or traveling to play that number 1 team in California, we have so many great sports around here. So we're really lucky. So trying to keep it a little bit local. Even Duke lacrosse, where I played, they're talking about maybe keeping a lot of the games kind of in the North Carolina region and only traveling as they need to. So I think that's really important. And
that maybe their football team can get some wins.
Oh, they're good now. They're good. We have some good football
we got
games these
quarterback.
days.
It's all good.
Okay. So going back to the third thing, I think athletes are just going to have to be prepared as well. So just like you guys were saying, I think a lot of that extra training might have to be in their homes with the flexibility, the power training, the lifting. That may have to be done through some of the video opportunities in that route. And then I'll turn it over to Dr. Roach.
Yeah, real quick before Dr. Roach gets on that one, one of the other things that I would just make a plug for is for parents and coaches to start thinking about how parents are going to be able to watch their kids play, because we saw the UFC return this past weekend for the first time, and we saw fights in front of an empty stadium. And so, as we consider how this is going to affect, this doesn't just affect the kids. I mean, this affects parents tremendously too. And so I think coaches and parents can work together preemptively to think about some, leveraging some of the technologies that we're using now to allow distance watching. And
same for recruiting too. It's going to be the same way.
So Dr. Roach, sorry, how's the team dynamic gonna take a hit here?
I mean, I think what we're asking them to do is so foreign, because it comes naturally that something goes well and you're going to go give the person a high five or pat their back so it's going to happen. And I think one of the big things I always talk about when working with kids between 12 and 25 is that their frontal lobe isn't fully developed. So impulse control and decision making, they don't have fully formed. And now we're going to ask them to put these rigid rules in place that they're not going to be able to follow even if they want to. It's going to take them some practice. So I think we have to be forgiving of that and appreciate that and appreciate we're going to have to retrain ourselves to do things that came automatically. I don't think it's impossible, but I think it is odd and weird that they're going to have to try to not have that congratulatory stuff that they're used to. So I think we're just gonna have to be creative in ways that we can do it in other expressions of the same enthusiasm, so it's going to be
good job.
Snap thing. Yeah. You see how I feel about that one, but things that we're going to have to be able to do that will limit some of the touching. But I think to me, what I find sort of a challenge for you guys as administrators and coaches is they're also young, so that they're going to have a hard time with this, and they're not going to do things intentionally, but they're going to do things that can make people uncomfortable unintentionally. And so we have to be patient and rigid and hold the lines. And it's, you guys are in a tough spot and I feel for you, but I still think ultimately it's going to be really good if we can get them out there for all of us. I think, again, the parents are going to have to get used to seeing from a distance. And we're just going to hopefully see how this all plays out over time, and that it won't be, our worst case scenario that we fear. It'll be a better version of it.
Mm-hmm. Well, another question that came through for Dr. Roach, that there are, whether they're kids who are affected or their parents or family members or friends who may be affected by the disease itself, we see tremendous effects in the first responder population right now, and in healthcare workers who've had to deal with this. For kids and their parents going through this, what are some good resources available to them that can be helpful?
I mean, I think a big piece of what we're talking about is loss. And so I think a lot of the literature out there on loss, Kubler-Ross's model, I think one of the biggest parts of that as well is when we work through all the emotional piece of that loss is growing through it. And so I think there's a lot of Hold the Door is an organization, it's a nonprofit that has a lot of growth through adversity, free resources online. I think, and again, it's also figuring out for your family, your kid, your circumstances, what the best resources are. For some, it's going to be a religious, maybe really supportive and give them that kind of guidance. For others, it may be more research-based. For some, it may be, my profession that they can reach out to. And, most of us are working really hard to slide scales, do pro bono, and be available in ways that we can. So those would be some of the ways I would say, and I think the biggest thing is compassion for ourselves and for the others, is everybody's affected by this really differently. And so trying to be sensitive to that, where, even coming back, some kid may really want to, but their family circumstances won't allow them to. And so being sensitive to that and trying to figure out how to keep them included, even if they can't be on the field.
Mm-hmm.
I think one thing that helps too is really keeping to some sort of routine. So one thing that the football club or soccer club of Barcelona tried to do was recreate what their weekly schedule would be. So they tried to recreate, if they had 2 games that week, a couple days of pretty high intensity stopping, starting, acceleration, deceleration, their same type of lifting routine. They tried to keep them to the same time every day to do things, because we do develop that natural rhythm in our bodies of when we're ready to go, when we're prepared. So as we're inching closer to being at least maybe in a small group setting, it's kind of important to start preparing both your weekly training routine, so you get everything in. And second would be your daily training routine. So, really starting to get away from that sleeping till 9 o'clock, 10 o'clock and get everything going.
What's that like, sleeping till 9 or 10 o'clock?
The 4-kid crowd. I don't know, Sam. We're never going to
I think
understand
at
that.
least between the two of us, we got 8. So it's,
Yeah.
the one of the other things, Karen, that you brought up earlier, which I think, I certainly hadn't thought about this angle of it before, is how's the recruiting process going to change? I think that's an outstanding question that you asked yourself. So I'd turn your question on you.
All right, bravo. A couple of things that the lacrosse community is recommending, and I even tell this to some of my patients who are athletes, is to start putting together videos that may not even have to do with your sport, but show how you're doing some of your performance training. So in the backyard, show them how explosive you are, your plyometric training. A lot of organizations around here have been working really closely with the performance coaches. So having somebody videotape that. So they do like to see how hard you're working during this time. And I think a scheduled synopsis of that is very helpful. The second thing they would like to see is your personality. So when you're allowed to contact these coaches, talk about what you're doing. I mean, it could be as silly as you're the leader of your household. If you do have a household of 4 kids like myself and Dr. Taylor, which is mayhem, you may be the oldest. And so you're kind of getting them outside to run or do things. Or maybe you're the captain of your team and you're putting together some just fun Zoom meetings like, hey, here's how we're weathering the storm here and what we're doing. So they want to see personality. They still want to see you working hard. And again, it goes back to a lot of athletes being multi-sport athletes. So, if you're being recruited from lacrosse, but you're playing 1v1 basketball with your brother or sister in the backyard and showing some amazing footwork, put that in your video.
How do you guys feel, on a practical level as well as an emotional level with these kind of COVID groups, where you get people are talking about having a small group of people where they're kind of quarantining themselves, but doing it together. How do you feel about that from a training perspective, and as an effort to transition from some of the low to mid risk activities?
I think, first of all, it's important to assume your own risk and your own household's risk. So first we talk about our household. Do you have a grandmother who helps to watch the children? Do you have somebody, like, for example, some of us were going into New York and helping during the COVID crisis. So it's important to realize, maybe that would not be the time I would have my children socialize. But if you've been somewhat, quarantining yourself, and then the children have played with some of these kids before, and they're happening to ride bikes in the area in a socially distanced fashion, or they're running in a socially distanced fashion, which of note, the running distance does increase in terms of social distancing compared to just standing still. But I think there still can be some opportunities to gather. And again, I would point out that outdoor activity is much, much safer than indoor activity. So that's something to think about too.
So we have one final question from the audience for Dr. Roach. So what are some healthy ways for parents to help motivate their athletes to prepare for return to play?
Yeah, I think as a parent, you're in a tough spot because you're going to annoy them in their adolescence, and they'll tell you that you're annoying.
I've never heard that before.
So I think it's that gentle reminder. I think it's trying to make it fun. I think kind of piggybacking on what Dr. Sutton was just talking about, it's having, if there is a way to safely do it, or even if they have siblings that they can play their sport with, being able to have that opportunity. I think, again, you have to mitigate the risk for your family that's safe for you. And I'm by no means an MD. I would make no assumptions on the best way to do that, or even say what you should do. But I think keeping the fun in it is going to increase the likelihood that they're going to want to do it. I think you're going to get a big pushback, and that's where it's like it's this balance I keep talking about is it's like those scales, those judicial scales of physical health and mental health, and how do we do both? And I think for them, they want to do it. I think what's hard is when there's no goal in sight, it's really difficult for them to be like, well, why am I doing this if my season's not going to happen this fall? I'm sure as parents you've heard that, and so it's
because you don't know it may happen.
I keep saying some genius wake up tomorrow and totally figure it out.
Because I said so.
Yes, all those work very well. So I think you got to be patient with them. I think if there's a way to get their peers involved, that's going to increase their motivation. Yeah. Working with them on some goals that might be things that they can do in this circumstance that they can work towards so that they see some progress. Those are some things. But yeah, they're going to be tough on you. Then they talk to me.
Good luck, Dad. Yeah. So unfortunately, I think that's all the time that we have today. And talking about doing fun things and trying to have a little bit of fun with some serious topics, I think we accomplished that goal today. I know I at least enjoyed this conversation, and I hope all of you guys out there who are listening in and watching did as well. So what the heck, let's do it again. How about next week? Sprains and strains, injuries of the foot and ankle coming at you. So awesome. Stay tuned. We're excited here at HSS to be helpful to our community and to hopefully shed some light on some interesting topics in a real tough time for everybody. So
stay safe, everyone.
Thanks, guys.
Thanks.